Welcome to this session all about Ataxia Centers of Excellence. Happy International Ataxia Awareness Day for everyone. My name is Dr. Celeste Seward. It is my privilege to welcome you to this session on behalf of the National Ataxia Foundation. We have a double feature for you today, folks. First up, we have Dr. Kelsey Trace, who is the Clinical Services Director at the National Ataxia Foundation. She earned her bachelor's degree in neuroscience from the University of St. Thomas and completed her doctorate in occupational therapy at Creighton University. Prior to joining the National Ataxia Foundation in 2019, she worked as an occupational therapist in skilled nursing and dementia care settings, with a focus on enhancing functional independence and quality of life for individuals with neurologic and geriatric-related conditions. At NAF, Kelsey leads a range of national programs in an effort to improve clinical care for individuals with ataxia. These programs include NAF's Genetic Counseling and Testing Program, the Ataxia Centers of Excellence Program, which we're going to be learning about today, and Healthcare Practitioner Resources. The Clinical Services Division at NAF also manages the Clinical Research Consortium for the Study of Cerebellar Ataxia, the CRC-SCA, and the Ataxia Clinical Training Program. Kelsey is passionate about driving progress in rare disease care through evidence-based, patient-centered initiatives. And our second speaker today is Dr. Sharan Srinivasan, who is an assistant professor within the Movement Disorder Division at the Department of Neurology at the University of Michigan. He attended Northwestern University for his bachelor's degree and attained his combined MD-PhD at the University of Michigan. He then completed his residency in neurology at the University of Michigan before pursuing a movement disorders fellowship at Mass General Brigham at Harvard. He returned to the University of Michigan in 2022 to continue his clinical and scientific efforts in caring for and treating cerebellar ataxias. Clinically, Dr. Srinivasan co-directs the University of Michigan Ataxia Center of Excellence and is the University of Michigan site PI for the Clinical Research Consortium for the Study of Cerebellar Ataxias. His research interests involve the pathology of cerebellar ataxias, particularly hereditary polyglutamine disorders. His passion is in developing novel therapeutics via a multidisciplinary approach, combining strategies from organic chemistry, molecular biology, neurocircuitry, and emerging genetic technologies. His focus has been on targeting impaired neuronal circuitry within these disorders and the amelioration of which has been shown to improve motor symptoms and delay degeneration. So, as you can tell, we have two powerhouses with us today. First off, I turn the floor over to my colleague, Dr. Trace. The floor is yours.
Thanks so much, Celeste. I am so glad to be here. Thank you all for tuning in. So today we'll be talking about Ataxia Centers of Excellence, which you may sometimes hear shortened as ACE or ACEs. So we will go ahead and dive in here. I first want to talk about the goal of this presentation. My wonderful colleague Celeste, who many of you know through Prep Rare and All About Ataxia webinars, gave me a list of questions to answer as we go through today. And that list of questions reminded me of these worksheets from elementary school or maybe junior high. I don't know if you remember them, but I affectionately call them the WHAS, the who, what, when, where, why. So I remember having distinct memories from elementary school of these worksheets where we'd read a short story. And after reading the story, we would fill in all of the different was here. So who, Jack and Jill, what, went up the hill, you get it. So I am here today to tell you a bit about the story of ACEs. And hopefully with that, I will be describing what they are, why they matter, while also answering the other what questions, if you will. Then I will pass it over to Dr. Srinivasan, who will talk about kind of an inside view of ACEs and what it's like to go to one. So I'm doing kind of what are ACEs, why do they matter, and then he will give us an inside view of one ACE. So with that, we will go ahead and dive in. Let me tell you a story. Once upon a time, I'm kidding, but I am going to try to tell the story of ACEs, and I'm going to try to make it kind of as interesting as possible because I do worry that kind of the how might get a bit boring, but I'm gonna try my best. So I'll go ahead and begin. Let's say you go to your annual physical with your general physician that you have been seeing for years, and you say, you know, it's kind of weird. I've been falling more. I noticed I've gotten a little unbalanced when I go hiking or walking up a hill. And your doctor, your general practitioner, maybe watches you walk does a few balance tests and notices, yeah, it looks a little different. Looks like it might be a brain issue, not so much a muscle issue. I think you should go see a neurologist. Great. So you go home, you Google neurologist near me, you pick a clinic in your network, you look through kind of the long list online with all the pictures, and you choose a neurologist. You set up an appointment. You can't get in for months. But then you do get in and you go see the neurologist. They ask you more questions and run more tests. Maybe they say, I think you have ataxia. Maybe they dive in a little more. Maybe they accidentally send you down a different route, different diagnosis route. If you're lucky, you get a neurologist who says, I think you need to see a movement disorder neurologist. But that means you have to still go home, find that specific type of neurologist at a clinic near you. And you have to, again, go online, find that neurologist, find where their office is, see if it's close to you. And then even then, movement disorder neurologists have different specializations. So they may have specializations in Parkinson's or stiff person syndrome, dystonia, the list goes on and on. All that to say that a movement disorder specialist still might not know how to diagnose ataxia specifically enough because it was one lecture, one day of med school, which is frustrating, right? So that's exactly why the National Ataxia Foundation's Ataxia Centers of Excellence program was born. So we'll go ahead and fill in our worksheet here. Why do we have Ataxia Centers of Excellence? It's too hard to find neurologists who know enough about ataxia. So we will go ahead and continue on with our worksheet and kind of quickly knock out the when. You may know this from your own history with NAF, but the National Ataxia Foundation was founded in 1957. There was one doctor researching ataxia because he noticed generations of his own family exhibiting similar symptoms that worsened over time. The doctor's family formed the National Ataxia Foundation, and today there are hundreds of ataxia researchers and clinicians around the world. The National Ataxia Foundation fulfills our mission in these ways over here on the left. And one of the main goals of the Clinical Services Department is to improve clinical care for ataxia patients. Ooh, my slides just went through here. Okay, bear with me. All right. Here we go. Sorry about that. So we have been hearing for a while at NAF about how, kind of like the story I just told, about how patients would go see their general practitioner or general neurologist, and the doctor didn't know what ataxia was. And that's obviously a problem, and there's no single easy fix, but over the years, NAF has been trying to address this issue in various ways. We have been providing doctors and researchers with funds to better understand ataxia. We've curated kind of a semi-vetted list, if you will, of neurologists around the world who know about ataxia because they contact us and say, hey, put me on the list. I can certainly see patients with ataxia in this city in the United States or the world. We also attend healthcare practitioner conferences, such as the Academy of Neurology, AAN, and MDS, or Movement Disorder Society, to spread awareness to providers. We have created multiple day-long courses for neurologists and many other ways in which we fill our mission. So still, in the end, people still contact NAF and say that their neurologist has never heard of ataxia. And we would say, well, where are you located? And they would say Boston. And we would say, have you heard of Dr. Schmaman in Boston or Dr. Rosenthal in Baltimore? And I could name several others on the East Coast. But no, not necessarily. And that's okay. Why would we all know exactly who specializes in different diseases? But there needed to be a way to easily identify the clinics who are providing that most comprehensive care for patients living with ataxia. So that is that's the when of when ACEs were born. There is still always will be room for improvement, but very quickly, I guess, if you will. It was kind of a long when, but we were founded in 1957. We developed that neuro list that I talked about, which is a list on our website of neurologists who know about ataxia and tell us that they see patients with ataxia. And then we formed ACEs, Ataxia Centers of Excellence, in 2023. And now we will talk more about what is an ACE. So the goal of the National Ataxia Foundation ACE program is to designate exceptional regional care centers that provide comprehensive care and who are engaged in clinical research here. In addition to providing that clinical care, we also expect that they provide professional and lay education to patients and their families in the areas they serve. And we also expect them to work with NAF or other ataxia patient groups, especially if they're international. It's not always easy to work with NAF per se, but they could work with the ataxia group in Italy if they are in Italy, for example. So those are kind of the four main pillars of what it takes to be an ACE. We have a few other requirements as well. Sites must have 2 or more neurologists, or APPs, which stands for advanced practice practitioners. So those are the nurse practitioners and the physician's assistants. And those specialists must have specialized training in ataxia or movement disorders. The site must also provide clinical care for at least 30 ataxia patients annually, and patients must span a variety of ataxia types. So if a clinic only sees patients with Friedreich's ataxia, they would not qualify to be an ACE. There were a couple what questions. We're going to go through a couple here. What kinds of care or services might you find at an ACE? So the ultimate goal would be a clinic that has all the care you need in one place. So you go in, you see the neurologist, then you walk next door and go see the genetic counselor, have a genetic counseling appointment, you stop by the therapy gym for physical therapy, everything kind of all in one place. But as you can imagine, there are lots of different setups at different clinics, and not every clinic is set up exactly like that. So sites can refer out to other disciplines and expertise. We do allow that, but we expect that ACEs at least have the ability to refer to other services that would be needed by patients with ataxia. I will mention too that there is one model that we've heard a lot of success with, and it's more of an interdisciplinary ataxia clinic model rather than multidisciplinary. And what we hear is that they will have a clinic for a half day, and the patient will come in, they will go to the exam room, and then the specialists will rotate through that room so that the patient can stay in one room and see all of the services that they need in one half day. And then at the end of the day, the specialists, so the neurologist and the genetic counselor and the OT and the PT, they all have a meeting dedicated to the clinic day, and they talk about kind of the plans for each of the patients, the follow-up needs, and that allows for mutual decision making. So that's been a really successful model that we've seen in ataxia care and neurology care in general. And so that is a good way to provide all of the care kind of at once. I think there's one more what. Yes, there is. So my other what question is, what makes an ACE different from an ataxia clinic, a movement disorder clinic, or a general neurology clinic? I like to think of it on kind of a broad to specific scale. So that general neurology clinic has neurologists who are trained in the brain, obviously. But when you think about how many different brain diseases you know of. I bet you could think of 15 in the next minute, right? There's headache, there's migraine, there is autism, there's dystonia, there's Parkinson's, there's Alzheimer's, there's frontotemporal dementia. We could go on and on. All of that to say that a neurologist who has general neurology training has to know about all of those different diseases. And so therefore it is likely that they know a little bit about each of those, but it's harder to know a lot about all of them. So that's kind of the broadness of a general neurology clinic. They don't necessarily have disease-specific recognition. They can provide kind of general health advice for all of the different kinds of neurological disorders. And then we come down to the movement disorder clinic, which is more specific in that the neurologists there have gone on and done extra training in movement disorders. Some of those movement disorders includes Parkinson's, tremor, dystonia, but again, the list is not short. There are lots of different movement disorders, and sometimes some of the diseases that are more that get more funding tend to be more emphasized at some of these clinics. So a movement disorder clinic, most of their clinicians might see Parkinson's or know the most about Parkinson's because the Michael J. Fox Foundation is providing more grants for them, just as an example. So there are fewer ataxia-specific resources at those movement disorder clinics sometimes, depends on the clinic. That brings us then next to Ataxia Clinic, which is a general kind of tag that someone might choose to put on their clinic. But if they are saying that they're an ataxia clinic, then they likely know a lot about ataxia. They might have one or two specialists or more that see patients with ataxia, and but they tend to operate a little bit more independently. They're not part of a network, if you will, but they do have a lot of knowledge about ataxia. So that brings us down to ACEs, the most specific of these different types of clinics. That again stands for Ataxia Centers of Excellence. These ACEs have been vetted by NAF. They've been reviewed. They have to meet specific criteria that we just discussed. And then they become part of an international ACE network, and they can engage in exchanging data and expertise. So they provide kind of the highest, most comprehensive coordinated care and the most specialized care specific to ataxia. So we've done the why, the when, the what. They are multidisciplinary clinics who provide comprehensive expert ataxia care, education, patient support, and research opportunities. That brings us to the who. A couple years ago, I went to go visit Columbia University over here, and I was going for a research visit to kind of shadow the doctor and the coordinator there. And so I knew that I was going to meet with Dr. Kuo and Nadia, and they said, come to lunch, we'll have lunch as a team. It'll be great. And so I was excited. And I assumed that kind of our team was going to be these couple of us who were doing this ataxia visit. And I walked into the break room, and it was this whole team of people, which was super cool. So it was like all of the neurologists and all of the nurse practitioners and the PAs and the researchers, all of these people who are part of this Ataxia Center of Excellence at Columbia. So I just wanted to share these two pictures. They are both the ataxia teams at different ACEs. This is the ACE in Peru. And so it is a whole group of people who are working to provide that very specialized care. So that is our who, which brings us down to our last two parts of our worksheet, if you will. The next one is the where. So where are these sites? The National Ataxia Foundation is, as you know, based in the United States. So Much of our messaging goes out to practitioners in the United States, although we do reach the world as well. Excuse me. But you will see that the sites that have been designated, there are 25 in the United States. And as much we're going to continue to try to expand this list because we would love to have one in every state, but they have to meet those standards at the same time. And even then, I recognize that having one location in one state still means a lot of travel for people. So we are continuing to work on our mission of educating practitioners in all sorts of ways. But these are the 25 US-based sites during the first 3 years of our program so far. I mentioned that we are the National Ataxia Foundation. We do allow international applicants, and we do designate international sites as well. And so this is our list of international sites who have garnered the ACE recognition as well. All right, so who, what, when, where, why, the where, 25 US ACEs and 9 international ACEs. That brings us to our last box here, which is the how. So how do I find an ACE? I'm going to go ahead and be your tour guide here. And I am going to bring you to our website real quick. This is our, oops, I'm going to try to make this, our NAF website. And it is ataxia.org, as many of you likely know, /ACE. And here we list all of the ACEs. Here on the map are the United States ACEs, and then the international ones are listed below. And so we are going to go ahead and click on New York today. So blue are all the states that have an ACE, and then the stars are the cities that have the ACE. So if I click on New York, you can see that there are 2 ACEs in New York. And then if I go ahead and click on detailed information, I can see a few things about NYU that maybe are kind of hard to find on just their general website, right? That are specific to ataxia. So if I want to know, are they accepting new patients? It tells me that here. How do I schedule an appointment? That's different sometimes at every ACE, but they are accepting new patients, and referrals are not required. That's often a question that you have to sometimes wait and click through all the buttons on the phone to get to figure out if referrals are required. Another really great thing about this website is it lists the specific providers at this particular ACE that see patients with ataxia or who have the most specialty in ataxia. And so here we list the provider at NYU that sees ataxia patients. And then if you click here, it brings you to the website of NYU. I really like their websites. I'll just show you quick here that even if you're trying to find a doctor in movement disorders, it still gives 37 results. And so knowing from this NAF website who are the specific doctors that see patients with ataxia is really helpful, because I can just look for Dr. Guel Paredes instead of just picking one of these 37 who will still know about ataxia. But if I want the one at the clinic who knows the very most, then I'm going to look right here on the ACE webpage. So that is the how do I find an ACE. We have one more how here. So how are ACEs selected? NAF accepts applications 1 to 2 times per year. We advertise to clinicians primarily. We also advertise to patients. You may see that in your email, and we will say, hey, is your clinic providing the best ataxia care? Please tell us what clinic you're at. And then NAF will reach out to that clinic and ask for more information and encourage them to apply. So it is an application process. Sites have to apply in order to be designated an ACE. Once applications close, we review them. We have a review committee that consists of NAF staff, NAF Medical Research and Advisory Board members. So that's doctors and PhDs within the ataxia community. We have industry representatives who review them, and then we also ask patient representatives to review the applications. There are 2 to 3 reviewers per application, and reviewers get a form to fill out, and they get the application, and they match the application to all the criteria in order to help NAF decide if that site should be an ACE or not. I will plug, if you're interested in being a patient reviewer, I'm always looking for reviewers, so just email me, kelsey@ataxia.org, or if you have a site to recommend, same thing, please email me at kelsey@ataxia.org. After we review applications and decide yes or no based on scores, we announce the sites to the community, and then we provide a toolkit to the sites, and we provide kind of this network for collaboration between the sites as well. So that is our whole worksheet. We filled it all out. So I want to thank you all for your time. Thank you, Celeste, for the introduction. And we will go ahead and pass it along to Dr. Srinivasan.
Thank you so much, Dr. Trace. We're going to shift over to the Q&A portion of this talk. Well, a specific pre-planned Q&A with Dr. Srinivasan, who, again, to remind you from his bio, co-directs the University of Michigan Ataxia Center of Excellence. Dr. Srinivasan, thank you again for joining us today. We appreciate your time.
Happy to be here, Celeste.
And as a bit of a disclaimer, this is one neurologist from one ACE. There might be some slight differences between ACE programs, but it's just to give you a sense of some of the things you may experience if you are attending an ACE or reaching out to an ACE from the neurologist side of things, but also the patient side of things. So let's dive into our first question. What is the process for booking an appointment at your ACE, Dr. Srinivasan?
Yes, thank you. So Kelsey did a great job outlining kind of, I think the journey that many patients experience, which is, experiencing symptoms of ataxia, whether that's difficulty with balance, slurred speech, trouble with your vision, or any of the other numerous symptoms that can affect folks. And oftentimes folks are bringing it to the attention of their primary care physicians, who then eventually say, yes, you need to go see a neurologist, who oftentimes is a community neurologist who may or may not have specialized training, or maybe a general neurologist that sees a wealth of neurological disorders, and eventually says, somebody recognizes, I think you have ataxia and you need to go see a movement disorder specialist, or ideally an ataxia specialist, and then we'll put a referral into our clinic. Fortunately, I think being at a major academic center at the University of Michigan, we've garnered a reputation for seeing complex and rare diseases in the state. And so a lot of physicians across the state know that, oh, this person has something that's a little bit unusual or a little bit more rare. U of M probably has a center that can help. And so we'll look up and say, oh, University of Michigan has an ataxia center. Excellent, let's place a referral. And then that referral gets sent to our clinic staff, who will review the patient in question. Oftentimes myself or other colleagues are asked to review the referral and make sure it's actually appropriate to come see ataxia clinic. And then once we say it's appropriate, then our clinic staff will work communicating with the patient to find an opening to schedule with either myself or Dr. Peter Todd, who's the other ataxia neurologist at our ACE.
And as a follow-up question to that, how long is a typical wait time from that referral to that first appointment at your center?
Yeah, so this is the biggest downside of coming to at least see me at the University of Michigan, is wait times can unfortunately be quite lengthy. So, for example, I think I'm currently booking out patients until March or April of next year. So we're looking at a 6 or 7 month wait list right now. A big part of that is because many of us ataxia neurologists spend time doing other things in addition to seeing patients with ataxia. And so, for example, both Dr. Peter Todd and myself spend a good portion of our time actually running basic science laboratories, doing fundamental research on on ataxias and trying to develop therapies and discover about the biology. And so, for example, I only have clinic 1 day a week, which means that there's a very limited number of slots for me to see patients. And certainly I try my hardest to overbook folks and see them whenever I need to. But as a result, there can be a lengthy wait time. And I know that it's pretty similar across many other ACEs just because ataxia providers are splitting their time between trying to see and provide clinical care as well as provide input into fundamental research, whether that's in the basic science setting or in the clinical research. There are certainly clinics across the country where folks are a little bit more clinically heavy. So UCLA comes to mind, and Dr. Susan Perlman, who's been a stalwart of ataxia care for decades at this point, who sees, ataxia patients multiple days a week. And so she's able to rotate through and see patients at an increased frequency and shorter wait times, I believe, compared to those of us who only see folks 1 day a week.
During this time, while people are waiting for that first appointment, what are some things they can do to prepare? Is there any kind of information they should be writing down and bringing with them to their appointment?
Yeah, it's a great question. And I think that I wish I could generate some sort of handout to give when patients are referred to help everyone involved. And that's, I think when I, as a neurologist, think about interviewing the patient, and really what's fundamental is no matter MRIs, blood tests, CSF, talking with the patient is the single most important thing that helps me understand what's going on with them and helps me diagnose them. And that means really taking the time to think about what are my symptoms? What are the things that really I don't feel like I can do normally or that bother me on a day-to-day basis? What has the progression over time been? And I spend a lot of time talking with folks on, do you think your symptoms come and go? They're infrequent, they're episodic. Do you think things are constant but gradual? Do you think things are truly getting worse? And over what period of time? And define worse to me. What does it really mean? What can't you do that you used to be able to do? And I try really hard, and I've developed, examples and prompting questions that help them think about their lives. But I think that's a huge help if someone can come in and say, things used to be episodic, they came and went, it would happen sporadically, and now it's all the time. And that gives me a really, really clear vision of what's been going on with this patient and helps me narrow what I'm going to ask next or other diagnoses I need to consider. And then because a lot of our ataxias are genetic or hereditary in nature, thinking about your family is really, really helpful. And many times we'll ask the question, was anyone else in your family, does anyone else have similar problems to you? And the answer is always no. No one else in my family has any problem. Tell me about your mom and dad. Well, mom used a cane or a walker as she got older. And one of the things that's difficult is there's a lot of reasons to use a cane or a walker when you get older, and understanding what's normal aging versus, inappropriate function is really difficult. And that's one of our hardest jobs as ataxia neurologists. But even thinking, oh yeah, my mom used a cane or she used to stumble, and grandpa had some tremors and maybe fell a couple of times. Or talking to your family members ahead of the clinic visit, asking brothers, sisters, cousins, hey, do you remember anything about mom, dad, auntie, uncle, grandpa, grandma? Did anyone else in the family have anything like what's been going on? And especially because, oh, I stumble, I need to use my cane, and I thought that's just because I was getting older. A lot of times siblings don't talk to each other and tell each other that, hey, I'm having this issue. It's very easy to almost blow off these symptoms as natural aging. And it's not until you really ask a specific question that sometimes it comes out that, oh yeah, several members of the family actually have trouble with their balance, or several members of the family have these episodes of vertigo and dizziness. And so thinking about what clinical symptoms you have, what's been the progression, and the lead up and how you're doing now? And then, is there any family involvement, or at least three huge areas that if someone's thought about those and prompted those questions or have answers to those, coming in is a tremendous help for me providing care.
Thank you so much for this advice. You've touched on this a little bit already, but what happens at a first appointment when someone's been referred to you at your ACE?
Yeah, so the very first thing for me is simply sitting down and talking, and it's I think one of the misnomers that happens in the field, and in our research we're starting to understand this, is the word ataxia itself isn't really clear. And many times an outside physician, whether it's a neurologist or a primary care, might just say, you have ataxia. And what's difficult is ataxia, the word is not a diagnosis, but a symptom. And it's usually the first thing that I say in a new visit is, you may have been diagnosed with ataxia. I want you to know that ataxia is a symptom that can be present as a result of multiple different diseases. Some of which affect the cerebellum, some of which affect other pathways, and our job's to try and figure out by talking with you and examining you, what's driving your ataxia. And then a long conversation, again, touching on some of these things. What are the symptoms that you struggle with? Tell me about your walking. Tell me about your vision. Tell me about your speech. Tell me about swallowing, bladder function, sleep, sexual difficulties, constipation, and a lot of non-motor symptoms that can accompany some of these ataxic disorders. And once I've got a good idea of what a patient is experiencing, asking about family history, medications, anything that can contribute to their current presentation. And then next would be a good neurological examination. And that might mean doing a full neurological examination and looking at vision and their speech and listening and trying to understand, are they having any speech difficulties? Observation is one of my most important tools, and simply looking at a person, how they interact with the world, with me, their loved ones, with the environment. When you're sitting there, do you have tremors? Are you shaking? Are you swaying? And then checking coordination and specific tasks that can be indicative of, say, cerebellar dysfunction to me. And by far and away, most neurologists will tell you the most important thing is watching somebody walk. And especially with ataxia, most of my patients have trouble with their balance and difficulty walking. And so I'll get them out in the hallway, have them walking, trying to push them in different ways to get a real flavor for what's been going on. And that history and examination is a huge, and is the two most important parts of my interactions with a patient. And then after that, we talk about what are the diagnostic tests, if any, that are important. Sometimes we need to get blood work. Sometimes in rare cases, we might need to sample spinal fluid. Many times we're getting imaging, usually in the form of an MRI, to get a high resolution picture of the brain. And then the last big diagnostic test that's really becoming more and more important is genetic testing. And so for that, we work really closely, and we're really privileged at Michigan, being an ACE, to have a wonderful genetic counselor who works very closely with us and helps talk to our patients about the pros and the cons of genetic testing, the risks, the benefits, the laws, insurance implications, figuring out, what pattern of inheritance, if any, exists in the family, what's the right type of genetic test to order, and then helps order testing. And so, that's really kind of how a patient's visit typically goes. And then, if we're, at least at Michigan, a couple days a month, we are lucky to have a on-site physical therapist and a speech language pathologist. And Kelsey alluded to some of this earlier in her presentation as well. And so sometimes it's somebody's having difficulty with their speech and their expression and their communication, or their swallowing. And so Karen Cluin, who is a fantastic speech pathologist, will work in our clinic, and she'll be, in the room next door to me. And so I walk the patient to her room to go see Karen, and she does her own examination and her own history, understanding what are the communication, the speech difficulties, the swallowing difficulties, offering strategies. How do we help you improve your communication, improve your swallowing? And if we need formal swallowing evaluations or other testing, then she'll suggest that we order it. And then a physical therapist is wonderful. And for the patients on this call, many of you have done physical therapy and probably have had either a good experience or a bad experience, or a neutral where, I did physical therapy, they were nice, they were knowledgeable, but I don't know that I got any benefit. And what's abundantly clear is that not every physical therapist is created equal and trained the same. And so it's really important to have a physical therapist who's neurology trained, and even beyond that, who knows what ataxia is. Because the physical therapy that we give to, say, somebody with Parkinson's disease, even though it's another movement disorder, is very different than what we give to somebody with ataxia. And so our physical therapists, and we have 2 that work in our clinic, are very knowledgeable, see a lot of ataxia patients, and will do things like we have different canes or walkers in the clinic for patients to practice with and understand, and they'll take them for laps around the clinic with different walkers to say what feels better or what feels worse. No, that's not a good walker. You should try this one. Will give me recommendations on specific assistive devices or specific physical therapies they should do. For folks that travel far to come see me, it's hard to find a physical therapist locally who knows ataxia. And so our therapist will print out a list of exercises, hand it to the patient and say, take this to your local physical therapist and say, this is what I've been advised to work on. These are the exercises to do at home, and really help them improve their function outside of the clinic, which is what's really important.
The benefits of comprehensive care. There's a lot going on at that appointment 1. After someone's first appointment, how often do people usually have follow-up appointments with your clinic?
Yeah, it's always an evolving target and a moving target. And I tend to, and I think there are a few of my own patients on this call who know this. And I say, if you're doing really, really well and you're very healthy and you're stable or slowly progressive, I tend to see folks between 6 months to a year of interim. And if I'm worried about you, or we're not sure about the diagnosis, or we're following up test results or or I want to do an examination or check how a treatment affected you, it might be on the order of 3 to 4 months if I can. And again, I have limited clinic time because of my other responsibilities. And so sometimes the scheduling gets pushed out a little bit because of that. But I usually tell folks it's a good thing if I'm not asking to see you back in a couple months, because it means that I think you're doing well.
A good problem to have, I guess.
Yeah.
And then one last planned question for you, Dr. Srinivasan. What's it like working at an ACE compared to perhaps a general neurology clinic?
Yeah, and so I can only comment on my own experiences when I was training either as a medical student or resident, a fellow, and working through various clinics. And what I would say is the difference with an ACE is, this is what we do, right? Ataxia is what we do. We live, we breathe, we eat these diseases. We think about them constantly. We're knowledgeable about the science, the clinical care. It's not like, if an ataxia patient comes in, it's not the first ataxia patient that I've ever seen, or even the only ataxia patient that I care for. It's one of many, and that's helpful. And you want that, I think, as a patient, to be with a physician who cares for other ataxia patients, to know what different patients experience. And that's because I learn from my patients as much as I try and help them. And I learn what works for them. And then I communicate that to my other patients. So, some of my patients have benefit from this, and here's what we can try. And I think that makes a huge difference. Working as a team, and we've talked about comprehensive care and having access to a genetic counselor, a speech pathologist, a physical therapist, an occupational therapist, a social worker. I can't express how helpful a social worker really is, who knows about the difficulties and the obstacles in the life of an ataxia patient as opposed to a Parkinson patient, and what, resources and, logistics they need in their day-to-day lives to function and to get to visits and to do well. And again, having that team and being a part of that team is really what makes, I think, the world of a difference. And I hope it means that we're providing better care for our patients. I like to think it does.
Well, thank you so much, Dr. Srinivasan, for sharing your experience and information about your ACE. We're going to move to the open Q&A session for attendees. As a reminder, if you have a question, please put them in the Q&A window at the bottom of your screen. Dr. Trace, would you mind joining us back on camera? Thank you so much. Actually, our first question is for you, Dr. Trace. Is NAF advocating for clinics to become ACEs, or is it up for a clinic to come to the National Ataxia Foundation?
Yeah, it's a good question. I would say both. So, certainly the only way to become an ACE is to apply to be an ACE. But at the same time, we will hear from patients or from other neurologists about a clinic in somewhere that maybe we haven't heard about, and we will contact them and say, hey, do you meet these qualifications? You should consider applying to be an ACE if you do meet these qualifications. So it's both, but I would say primarily it is sites that apply and then are reviewed by our team.
All right, and this question could be for either of you. We have an attendee who has shared that they've recently been diagnosed and they were diagnosed at an ACE. But now that they're diagnosed, the question is, can they be treated by their local neurologist? They mentioned that travel to the ACE that they were at was difficult. How does that usually work?
I guess I can field that one. Yeah, I mean, the answer is absolutely yes. And it sort of depends on the comfort of the local neurologist more than anything. And what I will do, and I do this frequently with patients who live, say, in the Upper Peninsula of Michigan and, have to drive 7-8 hours to come see me. I will offer and this is where a patient being able to tell me what symptoms really bother you is really helpful. And unfortunately, we don't have a cure for any of these ataxias right now. And so the focus of my care is on, all right, what are the symptoms that bother you? Because sometimes there's medications, therapies, exercises that can be particularly helpful. And then I'll list if it's to try and treat, for example, spasticity or muscle tightness, here's a list of medications, stretching exercises, physical therapy that might be helpful. If it's Parkinsonism that sometimes accompanies our ataxic disorders, here are symptoms. If it's nystagmus, bouncing of the eyes, here's a list of medications that I frequently try, dosing, intervals, how much to watch out for. And I'll put that in my clinic note and then try and fax it to their local neurologist or write it out and hand it to the patient and say, here's a list of things that your local neurologist can try that I recommend. And then I'll still try and say, maybe I'll see those folks once a year so that I can at least weigh in, offer guidance, and it's not hopefully it's not a, frequent burden for them to then have to come see me if it's just once a year. And oftentimes I'll see them follow up as a virtual visit as long as they're in the state.
That's very good to know.
And I would echo that, very quickly, by just saying that I've heard that from many ACE neurologists, that they are happy to work with the local neurologist of a patient and help in that way. So that was a great question and a great answer.
And in some sense, it's actually almost ideal if we can do that because it allows us to expand our access to other patients. Mm-hmm. Right. The more return visits that of folks that I have to come see me means less clinic spots for somebody else to come in who's never seen me before. And so if somebody's able to say, great, I loved it, I got my diagnosis, I've got a list of treatment options, I'm going to just see you once a year for follow-up, then it means that I can expand access to other patients who may not have a diagnosis or need to be worked up. So in some cases, it's even ideal.
And really in turn, we're educating the general neurologists as well by the patients advocating for themselves. So,
and I think that's a really great point, which is ataxia as a clinical symptom is almost like this phenomenon that's becoming increasingly recognized. I think that many of you in the audience probably have family members who are diagnosed with Parkinson's disease or multiple sclerosis or some other neurological diagnosis in the past. And that's because recognizing what ataxia is difficult and isn't something that is super common, or at least wasn't, super common. And so neurologists weren't recognizing it as much as they probably could have been. And I think that it is becoming increasingly recognized. And, thanks to some of NAF's great work and some of the outreach that's being done by a lot of advocates, I think we're making ataxia a more common diagnosis or a common symptom in the community and in the culture. And so I think that that's been really helpful for folks and for other physicians to say, oh yeah, I've heard of ataxia. I need to learn a little bit more about it.
Or building that network piece by piece. Our next question is for Dr. Trace. If a clinic becomes an ACE, do they receive funding or research support from NAF?
That is a great question. Due to limited funds, we do not offer funding at this time. The benefits are, of course, becoming part of the network, kind of advertising, if you will, on our website. And so those are the main benefits, but we don't offer funding at this time.
Very good to know. Our next question has been asked by quite a few people in slightly different variations, but folks who live in countries that don't have ACEs or are in places that don't have an ACE in their state, they're wondering if it's possible for them to visit an ACE in another country, and how does that work? I'm not sure if that would go to you, Dr. Srinivasan, or if that would go to you, Dr. Trace.
I can try, but Dr. Srinivasan, maybe you can follow up.
Sure.
I have heard of patients in other countries who do set up appointments at an ACE and then fly in and have their appointments. But I will pass it to you, Dr. Srinivasan, because that's
it's definitely done. Folks coming from Europe, I think the East Coast tends to get more of this at the Boston, New York, and Baltimore sites than I do in the middle of the country in Michigan. I certainly have folks who will come down and see me from Canada. That's very common. Folks that I've had one person fly from the UK because they had family in Michigan, and so they were visiting at the same time. But it is almost every US institution will do this. You have to work with them in terms of international insurance coverage. And so there are some logistics that need to be worked out, but in terms of actual clinical care, we're always happy to do it. We do the same thing in terms of providing recommendations based on, these are the symptoms this patient seems to be struggling with. Here's what I would recommend. The caveat to that is not every prescription medication is available in every country. So sometimes it's giving different alternatives, or at least giving names, and then the local neurologist in that other country might say, I can't get, baclofen, for example, in Nigeria, but there's another anti-spasmodic medication that is available more readily, and at least prompts them to think about what they can try.
So it sounds like it's a bit more complex. So reach out to an ACE, get some details before approaching this, but it sounds like it is possible.
Absolutely.
And then our next question, again, is for you, Dr. Srinivasan. So someone is sharing that there's so many different types of ataxia. Do ACE centers help navigate which specialist is best for someone's type of ataxia? Or how do you identify which specialist you should reach out to?
So it's an interesting question. I don't know that I would say that any ataxia expert is best suited for a specific type of ataxia. So I don't think that I would say you have SCA 3, and so you have to go see, this ataxia neurologist in the country. Most of us see a wealth of ataxia patients, and I have patients, for example, with 15 probably of the 50 SCAs. And so you get comfortable seeing all of them. And even though the genetics are different, there's a remarkable amount of clinical overlap between all of the SCA patients that the clinical management's actually pretty similar across many of them. So I don't think that you have to say, oh, I need to go see so-and-so because I have this type of SCA as opposed to that type.
Very good to know. Dr. Trace, our next question is for you. We had a few people ask this. If, as a patient, what can they do in order to reach out to the clinics they're going to advocate for them to apply to be an ACE? How can they encourage that?
Yeah, that's a good question. And we've had that happen at a couple clinics. And so I think first, finding kind of a superstar for you at that clinic. So telling your neurologist about the National Ataxia Foundation and the ACE program and informing them of the different qualifications will help. This has happened with a few applications that we've gotten we are going to get soon, where a clinic maybe just started with one neurologist who had an interest in ataxia, and their goal is to become an ACE, and so they're kind of putting that clinic together. They're finding a genetic counselor, a neurological genetic counselor that knows about ataxia. They're hiring an OT or a PT and a speech therapist, and they're creating that multidisciplinary clinic. They're finding the half-day clinic time a week or a month to have an ataxia clinic, and therefore they're going to apply to be an ACE. And so it's really kind of finding that superstar, if you will, at your clinic, who can then create that multidisciplinary clinic. I don't know, Dr. Srinivasan, if you have anything extra to add, but that would be my advice.
Yeah, I mean, I think that we've seen this happen, and I've, gotten asked about, occasionally ACE centers will get asked about other clinics around the country and say, what do you know about this person in this clinic? Like, are they actually, is this what they want to do? Or does that center have the resources to build truly? And usually the answer is yes. And like Kelsey said, I think the real limitation is usually someone who's willing to spearhead that effort and say, like, I want to make this an ataxia center of excellence. I want to see ataxia patients. I've got a team ready to work with me. And then the, annoying thing of doing paperwork to submit.
You can't escape the paperwork. Unfortunately, we are at time today, but we haven't been able to get to all the questions. If we weren't able to answer your question today, please email us at research@ataxia.org. We're happy to follow up with you after the call. I'm seeing a few about clinical trial involvement and also accessing genetic testing. But with that, Dr. Srinivasan, Dr. Trace, thank you so much for joining us today and teaching us a little bit more about ACEs. We appreciate your time and your expertise and your candor with your answers.
Absolutely. Take care, everyone.
Thank you.
And for everyone on this call, I hope you learned something about ACEs today. Wherever you are in the world, good morning, good afternoon, good evening. Have a wonderful rest of your day, and happy International Ataxia Awareness Day. Take care, folks.